Well, hey guys, Dave here, and hope you had a good Thanksgiving. I had to work on Thanksgiving, and also I had some time to work on something that I think is very important. Now, I normally don't do this, but I would ask you, if you do see this video, please share it, because I think I found out some information that some of you may find, very interesting. So, a little background on myself, in case you've never been on my channel or heard anything from me. I'm a nurse. I've been working in the medical field for over 12 years. I'm licensed to practice in the state of Texas. So recently, you may or may not have heard that there's this video that came out. It was a documentary by Stu Peterson called Dying Suddenly. And it was a hit piece on the C-19 vac. And it was just a way to try to get people to, just to be against the C-19 vac. So I decided I wanted to try to use my medical knowledge to debunk that video, but while debunking it and doing research, I actually discovered something that I thought it might actually help people. So I have my little script here. I'm sorry, but I'm going to read from it. I recently watched the documentary Dying Suddenly that was put out by people who are trying to say that the C-19 vaxes are deadly. I decided to research some of the points in the documentary so that I could debunk them. The one point I wanted to research and debunk was a claim that the vaxes cause cancer. One of the things that I discovered as I did my research is that when we had the lockdowns, people were unable to attend routine appointments, which allowed cancers to end up being caught much later than they would have normally if things had been running as they were before the COVID-19 lockdowns. Since there was less screenings, it makes sense that after almost 2 years of lockdowns, people's cancers were discovered and were more advanced. So think about that. We were locked down, people weren't able to get the screenings that they normally are able to get. And then when we got back into the smooth running of everything, 2 years later, a lot of people had cancers that could have been caught that weren't, and now they're further along. Okay, the second thing that I wish to explore is how it is possible the C-19 itself is leading to the rise in cancers in people. C-19 is a retrovirus. A retrovirus is a virus that once it enters a human cell, it then makes a copy of its RNA and adds it to the cell's DNA. The cell then begins making the copy of the virus, and this is how the retrovirus spreads. So for people who believe that the vaxes change your DNA, they're half right. The vax doesn't change your DNA, C-19 does. Mankind is already plagued by many retroviruses that cause cancer. Epstein-Barr virus is a herpes virus that can spread through saliva and increases the risk of Burkitt lymphoma and some types of Hodgkin's and non-Hodgkin's lymphoma and stomach cancer. Hep B is spread through infected blood and semen and is the leading cause of liver cancer. Hep C can also cause liver cancer as well as non-Hodgkin's lymphoma. HIV virus, which can be spread through blood or semen and it does not cause cancer directly, it is associated with Kaposi sarcoma, non-Hodgkin's and Hodgkin's lymphoma, cervical cancer, and cancers of the anus, liver, mouth, throat, and lungs. Human papillomavirus can cause cancers in both men and women, including anal, cervical, penile, throat, vaginal, and vulva cancers. Human T-cell leukemia is also another virus that can cause cancer in humans. Since C-19 is a retrovirus, and we see many retroviruses that cause cancer, it could be that people who have been infected by COVID once or even multiple times, who are now showing up with rapidly spreading first cancer diagnosis, got these cancers from C-19. It's not the vaccine, but it's the virus itself. Because when COVID enters the cell, its outer spike proteins that we've heard so much about bind to the human cell receptor called ACE ACE2. ACE2 is found naturally in the lungs, hearts, kidneys, and intestine cells. This is why some people were having myocarditis, not because of the vaccines, but because of the C19 itself. An infected cell then makes millions upon millions of copies and leaves to go out and infect other cells. It does this because the COVID binds to the cell receptor and commandeers the cell in order to make viral RNA and viral proteins in order to replicate itself. Retroviruses like C19, when converting their RNA into DNA, then also become part of the human chromosome. And this is where, like I said earlier, where people were half right about their DNA being changed. Retroviruses actually do change your DNA. Retroviruses can even infect sperm and egg cells, thus becoming endogenous, which means that they can be passed down from generation to generation. Now, this could explain many things concerning how cancers pass down in a family. It is known that cancer can be passed down from parents to children, and this may be possible due to the fact of endogenous replication. This could also explain why some people have long COVID, or why even people that have been vaccinated continue to show positivity when tested for C19. If the virus becomes endogenous, it may be with the carrier for a lifetime. So you have to understand that retroviruses, and one of the most famous retroviruses, herpes. When you get herpes, you have herpes for life, forever. You can't get rid of it. So it may be that even though that C19 is a new virus, we may be finding out that C19 is like herpes. So once you get it, you have it forever. That's why people are having long COVID, and that's why some people, even though they're vaccinated, it may not be showing any symptoms, keep popping positive. It's because that RNA is already being incorporated into their DNA. Okay, now this is the juicy part. This is the part that I think a lot of people will want to hear, and please, like I said, share this with your friends and family. With this knowledge, we can now begin to look at cancer in a way that gives us new insight on how to possibly better treat the disease. If cancer is indeed a virus and a retrovirus, there may be drugs already out there better able to treat the disease. Now, while doing my research, I came across ivermectin, and we all know what ivermectin is. Not the horse paste, but the actual medication that won the Nobel Prize for its creator for the treatment of river blindness in Africa. Ivermectin is an antiviral drug and is given in Africa to treat worms that live in rivers and can infect the human's eye if they bathe or swim in infected waters. And it can cause them to go blind. Now, while researching ivermectin, I discovered that countries in Africa which had large usage of ivermectin for river blindness also had significantly lower rates of cancers. Out of the 10 countries with the lowest rates of cancer, 6 of them were countries in Africa. Also, we have seen less COVID in Africa, even though they have had less people inoculated. So we're seeing less COVID and less cancer. Could it be that cancer is also a retrovirus, and because they're taking in large doses ivermectin to combat river blindness, that they're actually helping themselves unknowingly against cancers and COVID? Could it be that the proliferation of ivermectin being used to treat river blindness helped to prevent not only cancers, but COVID as well? Ivermectin has been shown in tests to prevent the growth of cancer cells and even kill some types of cancers outright. Could ivermectin, along with other antiviral drugs, be used to stop and possibly kill cancer cells, preventing death? The cancer rates in Africa have been steadily rising, but this could be due to outside chemical, environmental, or unknown causes. In order to better understand ivermectin's role in the prevention of COVID and cancer, more in-depth studies need to be undertaken. Also, for the proliferation we are now seeing in the West, oncologists should be asking patients if they have been infected with COVID-19, how many times, and whether or not they have been vaccinated. We could then better understand if the retrovirus nature of COVID-19 is the cause in the more cancers doctors are now seeing. If we could trace the cause of the viruses, we may then discover that cancer is a byproduct of the endogenous infection of human cells and the changing of cell DNA by retrovirus RNA. This makes sense that this would lead to cancers due to the damage done to the cells by the invading RNA of the retrovirus. So you see, when the retrovirus or any virus is putting its RNA into a DNA cell, it's damaging, and that damage is what leads to cancers. I also believe that ivermectin and other antiviral drugs should be used with surgery and chemotherapy in the treatment of all cancers. It is true that diet, environment, pollution, and chemicals are sometimes carcinogenic and can cause cancer, but also the passing down of cancers in families and cancers that arise in otherwise healthy individuals might be due to the spread of communicable viruses within the population. So this, I think, is so interesting. If we can prove that cancer is actually caused by a virus, then that would be a huge game changer. Because yes, there are other factors out there, carcinogenic factors, pollution, the food that we eat, if you smoke cigarettes, all that kind of stuff. But if cancer is a byproduct of a retrovirus, maybe a retrovirus from 1 million or more years ago that, like I said, is in our DNA because of the retrovirus's ability to pass its RNA down through generations, that would be amazing, because we already have antiviral drugs that we could use to better treat the cancer. New treatments. Also, it would help us to then discover vaccines against viruses if cancer is a retrovirus. So like I said, please share this. Research ivermectin. You will be surprised. I was surprised at how ivermectin is used and can really help dealing with cancers. And if I had cancer, or I had a family member that had cancer, I would say take ivermectin. You know, you're already possibly going to die. Who cares? Maybe the ivermectin will help, maybe it won't. But who cares? What else do you have to lose? So this is David, Zoe Zizzles. Make sure to like and subscribe, and please share this video. Thank you.